This is QTV Nightly News. I am Mudu Gajaga and thank you for joining us. First, here are the main news headlines. QTV engaged Minister of Health, Dr. Ahmadul Amin Samate, in an exclusive interview about his Ministry of Health and partners as they intensify its health infrastructure projects across the country. On Saturday, the Gambia Institute of Chartered Accountants, with the Finance Minister as their special guest, hosted a day-long engagement with members. The Gambia Teachers Union Young Teachers Platform, in partnership with Green Up Gambia, embarked on a 4-day tree nursery planting preparation activity in various schools in the Lower River region. Those were the news headlines, and now the news in detail. Welcome and thank you for joining us. This is QTV News. The government of the Gambia, through the Ministry of Health and Partners, is intensifying its health infrastructure projects across the country to meet the increasing health demands of the public. To understand the progress and significance of these projects, Usman Jatta engaged the Minister of Health, Dr. Ahmadul Amin Samate, in an exclusive interview, and he now reports.
Access to healthcare service is an essential cornerstone needed to improve lives. It is in line with this backdrop that the Barrow-led administration is closely engaging with partners like the World Bank to respond to the health needs of the public. Dr. Ahmadul Amin Samate expands on the government's commitment to improve access to healthcare service delivery.
The importance of health service delivery and the importance of having a healthy population, to national development. His Excellency is prioritizing the healthcare service delivery of the people for the people of this country. Now, by so doing, we cannot achieve that without giving access to people when it comes to reaching the health facilities. So improving access is what we are doing.
The government is currently constructing over 8 major health facilities nationwide. This is the ongoing construction of the Njao Healthcare Center, a $77 million project which seeks to promote healthcare delivery in the Central River region.
When you look at Njao, CRR itself is very long, and between major health facilities is a big distance, and densely populated. So we believe that having a health hospital in Njao will go a long way in alleviating the suffering of patients.
In the West Coast region, the government is upgrading the Wiam General Hospital at a tune of over $92 million to reduce the heavy dependence on major referral hospitals.
Before referring people from LRR, Mansakonko area, Kiang area, and even Fonyi area, all the way to Banjul, we could refer them to Biam, and then we equip Biam adequately, we staff it adequately.
Amidst the advancement of these projects, Minister Samate is confident about the country's future of access to healthcare service delivery once most of these projects are completed.
So having to put forward the foundation to build on it before we can roof it and furnish the building, for example, if it were, it's not easy. But we are very optimistic with all these construction, building of hospitals, other health facilities, procurement of equipment, training of people, getting better ways of getting drugs for the country.
These health infrastructure developments are a testimony to the government's unwavering commitment to attaining the healthcare needs of the citizens by 2026. Once accomplished, these health facilities will not only ease access to healthcare delivery, but will also reduce the high dependency on major referral hospitals like the Edward Francis Teaching Hospital in the capital. Usman Jatta, QTV News.
On Saturday, the Gambia Institute of Chartered Accountants, with the Finance Minister as their special guest, hosted a day-long engagement with members to navigate challenges and discuss the future of the accounting profession under the theme Business Opportunities in the Growing Economies. Usman Jatta again.
Auditors and chartered accountants play a pivotal role in the country's development by ensuring financial transparency, accountability and integrity in both public and private sectors. Through their rigorous examination of financial records, they help prevent fraud, reduce corruption, and instill trust in businesses and government institutions. As the year draws to a close, these accountants and auditors converge to decide the fate of their profession. Paul Gay is the president of the Gambia Institute of Chartered Accountants.
We are guided and bound by a set of rules which we must follow. From the way we carry ourselves, the way we conduct ourselves, the things we should say even and the things we shouldn't say. So if you're an accountant, we know you have to account for the correct figures. As auditors, the opinion that we express, is it the correct opinion? Because all of these things are important to the stakeholders, are important to the potential investors.
The economy of the Gambia grew at an average rate of 4.50% in 2024, and in 2025 is projected to grow to 5.7%, according to the International Monetary Fund (IMF). Moreover, growth is expected in the financial and manufacturing sectors, as well as distributive trade and commerce. The Finance and Economic Affairs Minister, Sidi M. Keita, who is a Chartered Certified Accountant, FCCA, and a Chartered Management Accountant, ACMA, and who holds a double master's degree in Business Administration and Financial Management, was the ideal guest speaker at the event.
We are trying to improve our economic development as a government, but to do so, the market must come to the center stage. And for the market to function properly, financial chartered accountants, auditors, valuators are the bedrock. So as such, it is very, very important that the trust that society places on us is discharged, and discharged fearlessly, because ours is not an easy task.
The event saw a series of presentations on various thematic areas, key amongst which were climate environment versus economic development, and importantly, work ethics and code of conduct, reminding participants to remain resilient and professional to shape the future of the industry and, by extension, the nation. Osman Jata, reporting for QTV News.
The Gambia Teachers Union Young Teachers Platform, in partnership with Green Up Gambia, embarked on a 4-day pre-nursery preparation activity in various schools in the Roa River region. Our regional correspondent Bakari Balde attended the activity and he filed this report.
The initiative, which started last year, aims to plant trees in schools across the country as part of efforts to mitigate climate change by providing a green environment in schools that is conducive for teaching and learning. This first cohort of tree nursery preparation targets 8 schools in the region. Momodu Bakadem is the Youth Programs Officer, Gambia Teachers Union.
You have schools that when it is during the summer, you have their when windstorms occur, their roofs will be blown away. But you also have schools also that are usually affected by flood. But also you go around this country, because of this policy of opening schools around no child should walk more than 3 kilometers to access a school. You realize that there are some schools that are opened, and then you have the environment is not that conducive for them because there are no trees. So the executive came up with an initiative that we call the Green School Initiative. One of the objective is to ensure that we plant trees in schools to promote a conducive teaching and learning environment.
Ibrahim Ekinte, the volunteers coordinator with Green Up Gambia, says this initiative is in line with their organization's goal and commends the schools for welcoming the move. He outlined the partnership with GTU Young Teachers Platform.
In our first initiative with them was tree planting exercise. And this initiative, when we discuss together with them, we see to it that it goes with our goals. And one of our goals is to educate the kids, the school-going children, about climate change effects, and we also mitigate the strategies that we can do to make sure that these effects are mitigated.
The seeds planted include moringa, pot mahogany, pawpaw, tamarind, silk cotton, sosop, orange, lime, guava, and mahogany. Francis E. Mendy, the teacher coordinator of Green Schools Club at Pakalinden Upper Basic School, says the initiative is timely and further outline sustainability plans for the nursery.
The way that we are going to sustain it is we'll divide them into days, whereby at least you will know the day that you will be responsible to water the plants. At least we'll make sure that by every day these plants will be watered.
Mr. Bakadem has this message for the young teachers.
We know we are young. We would grow in the education in the sector, but we also know that there are individuals that have the experience and the knowledge. So it is for us as young educators to tap into the experience of the old and bring in the innovators, our innovation as young teachers, so that we can move the education sector forward, because that is what the sector needs right now.
Fatou Njai and Hali Toure, both students from Pakalinden Upper Basic School, thank GTU Young Teachers Platform and Green Up Gambia for choosing their school and promise to take good care of the nursery. In propagating trees to combat climate change and to have environment conducive for teaching and learning in schools, the Gambia Teachers Union, Young Teachers Platform, and Green Up Gambia are hoping to embark on such activities in other regions in the country. Bakari Balde, QTV News.
From that report, we will now go for a commercial break, and when we return, we still have some more local news stories. Do stay tuned.
Introducing the QSmart and QSmart Plus, where innovation meets affordability. Capture life's precious moments with stunning clarity thanks to our high-resolution cameras. Enjoy uninterrupted performance with a fast processor and a long-lasting battery that keeps up with your day. The QSmart offers a 5.9-inch immersive display, powerful performance, and an all-day battery life, all for just $3,400. Plus get an incredible bundle of 15 gigabytes of data, 120 minutes of talk time, and 300 SMS absolutely free. Upgrade to the QSmart Plus featuring a faster processor and extended battery life and a larger 6.5-inch screen for just $4,000. With it, you receive a massive 30 gigabytes of data, 300 SMS, and 120 minutes of talk time completely free. All bundles are spread across a 3-month period. Don't miss out. Get your QSmart or QSmart Plus from QCell today. Discover the best in quality and value right here in the Gambia. Available at all QCell customer care centers across the country. For more information, call call 111. QCell Senior Boss. We innovate, others follow.
Welcome back and thank you very much for joining us. This is QTV News. The Ministries of Health from the Gambia and Senegal today ended a week-long joint meeting on malaria cross-border collaboration planning at a local hotel. Amadou Tamba attended and he now reports.
Malaria is a life-threatening disease spread to humans by some types of mosquitoes. It is preventable and curable. The infection is caused by a parasite and does not spread from person to person. This meeting was geared towards synchronizing mass long-lasting insecticide nets distribution campaign, which was successfully held in both 2019 and 2022. After the meeting, the Gambia will make it possible to develop the work plan and roadmap in which cross-border collaboration activities and implementation arrangements will be detailed out. Wandifa Samate, the acting program manager for the National Malaria Control Program, calls for unity to ensure that the 2025 mass distribution campaign becomes a success.
The recommendations that will be gathered will help us in our next meeting to finalize the actual work plan and ensure that all resources are available for the implementation.
The term malaria originates from medieval Italian mala aria, bad air, a part of miasma theory. The disease was formerly called ague or marsh fever due to its association with swamps and marshland. The term appeared in English as early as 1768 with fever, fatigue, vomiting, and headache as its symptoms, which usually start within 10 to 15 days of getting bitten by an infected mosquito. Doudou Sène is the head of National Malaria Control Program at the Senegalese Ministry of Health. This initiative started since 2018. We have different ways to fight against malaria, which the two countries are working together to eradicate malaria in Senegambia. According to the World Health Organization, WHO, globally in 2023, there were an estimated 263 million malaria cases and 597,000 malaria deaths in 83 countries, with the WHO African region home to 94% of malaria cases, 246 million, and 95%, 569,000 of malaria deaths. Children under 5 accounted for about 76% of all malaria deaths in the region. By Cham, the Executive Secretary Country Coordinating Mechanism of Global Fund the Gambia, says the meeting was an opportunity to reflect on what these countries has achieved in the past years as far as the fight against malaria is concerned.
We are so pleased to see that these countries, the Gambia and Senegal, has been keenly working on this effort together so that we are able to achieve our intentions.
Malaria can be prevented by avoiding mosquito bites and by taking medicines with sleeping under insecticide-treated nets, ITN, and indoor residual spraying, IRS, key in malaria control and elimination strategies. Mamadou Tignasi, the acting director of Health Service, reiterated the need for Gambia and Senegal to work collectively in organizing a synchronized insecticide nets distribution campaign with the aims of eliminating malaria in the next 6 years.
But that can only be achieved if we work collectively, responsibly, with an open mind and with a strong sense of responsibility.
Everyone has the right to quality, timely, and affordable services to prevent, detect, and treat malaria by putting up the necessary safety means. For QTV News, Amadou Tamba.
The National Association of Gambian Nurses and Midwives held its annual general meeting and award ceremony at a local theatre in Kanifing. Usman Jatta reports.
Nurses and midwives are the silent heroes of the Gambia's health fraternity who save and give hope to patients. After 12 months' service, the Association of Nurses and Midwives celebrates and honors its members. Samba Boy is the Secretary General of the National Association of Nurses and Midwives.
This will be a beacon of inspiration for our members, who are nurses and midwives in this country. It is gratifying to state at this embryonic stage that my team has worked relentlessly since being elected into office sometime in 2022 July. In order to fulfill the social contract we have with the general membership, who are the nurses and midwives of this country. We knowingly know that we have been a beacon of hope for the nurses and midwives of this country, and in that respect, we are obliged to deliver and to deliver beyond expectation.
Established in 1965, the year the Gambia gained its independence, the association represents, protects and promotes the welfare and interests of nurses and midwives, the profession and professionals nationally and internationally. Abdul Karim Fofana presented the association's 2024 activity report.
We came up with a project today. 100 nurse attendants are attending the CHNs and SEN program school for a period of 2 years. They will be trained as SENs and community health nurses, and these people, their life will be impacted positively as well as the life of their families.
Dr. Hadi Tungaraba was the guest speaker of the ceremony.
This event marks a significant milestone in the history of nursing and midwifery in our country. Not only does it provide an opportunity for us to review the progress of our profession, but also allow us to spotlight the dedication, resilience, tireless efforts of nurses and midwives who remain at the heart of healthcare delivery in this country.
With the mission to strive for excellence in the country's healthcare delivery through advocating and raising awareness, the event will inspire for the next generation of nurses and midwives to serve selflessly and with passion. Osman Jata, reporting for QTV News.
Still on medical matters, the Association of Health Journalists held its annual general meeting and symposium on Saturday on HIV and AIDS and gender-based violence. The event also provides a forum to discuss the association's achievements and challenges to charter a way forward for greater achievements. Mam Nabuka attended the opening ceremony and she now reports.
The Association of Health Journalists, established in 2001 with the support of the World Health Organization, trained the first cohort of journalists in health reporting in the Gambia. It urged journalists to conduct more research on health issues to avoid sensational reporting and ensure that underreported health issues were given priority. 23 years today, the association has become an active partner for health communication in the Gambia. This annual general meeting is part of the association's effort to come together, discuss, plan, and develop recommendations that will take the association to higher heights. The symposium aims to place a key focus on the HIV/AIDS virus and gender-based violence to see how best people can be educated about it through health journalists to reduce its adverse effects. Here is Sharif Saidi Khan, the Assistant Secretary General of the AOHJ, and Aisha Balde, the Executive Director of Paradise Foundation, a non-profit women-led organization that works towards gender equality.
HIV now is growing. We have seen the number recently globally. In fact, domestically in the Gambia here, HIV now, urban and rural, the number is rising. And it is at an alarming rate. And this is the time that we need to come together and engage the stakeholders to ensure that HIV, what are the efforts that are needed to address it and to stamp it out.
The way we've seen gender-based violence and the increase in numbers, we really need behavior change. We need interventions that will change. And we cannot do it without the media, and journalists are the custodians of the media.
After being dormant for quite a while, the AOHJ was recently revitalized in 2022. Sali Jaju, the president of the association, highlighted some of their achievements and also shed light on some of the challenges they face.
The Association of Health Journalists had its first engagement. That was a training for 15 of our members on gender-based violence. 8 of our members joined other media networks in the country to benefit from a 5-day training on nutrition. AOHJ is also a member of the Tobacco Control Committee. So despite some of these achievements that we have made, I must say that we are confronted with a lot of challenges as an association. Our financial muscle is not that strong. So we rely on partners to fund some of our activities. So we could not roll a lot of training programs for our members, but we hope that in 2025 we would be able to do that in different aspects.
The Association of Health Journalists plans to leverage its platform to inform the public and policymakers about pressing issues that concern the nation's public health, aiming to foster a more informed and compassionate society. Sheriff Saidi Khan shares the outcome they hope to achieve with this symposium and general meeting.
We hope to achieve that our message will be transmitted and it will serve as a vanguard to those that are our stakeholders to come together and also eliminate HIV and AIDS and gender-based violence.
As part of the event, certificates and gifts were given to the fallen heroes as well as veteran journalists who played a significant role and poured invaluable effort into the development of the organization. This symposium served as a crucial reminder of the work that still lies ahead in the fight to ensure that accurate health reporting continues. Mamna Buka, reporting for QTV News.
Well, that's it for QTV News tonight. Thank you very much for watching. Join us for more news in our subsequent editions.